Good evening. This is Committee of the Whole of December 20th, 2021, the last meeting, I believe, for the year. Before we begin, I'd like to read a declaration. So pursuant to the gubernatorial disaster proclamation, the declaration of emergency for the city of Urbana, Illinois, related to the COVID-19 pandemic, and in accordance with the changes to the Open Meetings Act, Public Act 101-0640, it has been determined that an in-person public meeting is not prudent or safe at this time. Members of the public body will attend remotely using Zoom webinar. Members of the public may attend via Zoom or view meetings remotely on Urbana Public Television for Comcast Xfinity on Channel 6 and 1096 i3 broadband on Channel 6, AT&T UVerse on Channel 99, and streamed on the web at livestream.com/Urbana. Will the clerk please call the roll?
Ms. Wu,
Here.
Mr. Evans,
Here.
Ms. Hersey,
Here.
Ms. Colasetti,
Here.
Ms. Bishop,
Here.
Ms. Wilkin,
Here.
Mr. Quisenberry,
Here.
Mayor Marlin.
Here.
Thank you.
There you go. Sorry. First item on the agenda is approval of the minutes from previous meetings for December 6th, 2021. Can I have a motion?
I'll move approval of the minutes for December 6th of 2021 with the Committee of the Whole.
Second.
All right, moved by Jay and seconded by Grace. Any corrections or discussion? Nope. All right, will the clerk please call the roll?
Mr. Evans,
Here. Yes.
Ms. Hersey,
Yes.
Ms. Colasetti,
Yes.
Ms. Wu,
Yes.
Ms. Wilkin,
Yes.
Mr. Quisenberry,
Yes.
Ms. Bishop.
Yes.
All right, any additions to the agenda this evening? No. Nope, I don't see anybody. The next item on the agenda is public input and presentation. And the first item up is a status report on crisis co-responder team. Who's going to be presenting on that tonight? Bryant, is that you?
It's going to be a team effort tonight, Mary
Okay.
Alice, but I'll get us started here. So good evening, council, mayor, and public. Tonight, we're going to give a quick overview, status report, if you will, on the crisis co-response team, making sure that everyone is well-versed in what exactly it is that they're doing, and hearing from some of the team members, and then even having a chance for some numbers as far as some of the statistics they've gathered here, and excuse me, as well as I guess maybe a couple of anecdotes. As you all recall, this effort was years in the making, and we were able to, I think we had our public hearing back in October here before the Urbana City Council, and we were able to then later that month get some things started. And so that's sort of what we would like to talk about tonight. So tonight you will hear from Lieutenant Corey Coker, who oversees the plan, as well as Paige Bennett and Shelby Moreland, the members of our co-responder team. So I will let, at this point, Lieutenant Corey Coker turn his camera on, and he will, I guess, go forward from this point.
Thank you, Chief. Council, the Mayor, thank you for having us. I apologize, I'm losing my voice, so I will speak up as loud as I can. If someone can't hear me, please let me know. Also joining us is Melissa Pappas from Rosecrans. She's a certified community behavioral health clinic implementation manager. So I just wanted to take a moment to go over the program to remind people of our purpose. The program was initiated on October the 11th of this year. It's a one-year pilot program. There are several different models all across the United States and even locally. The University Police Department's COAST team, which is community outreach and support, actually has social workers responding to crisis events with uniformed university officers. Their program is one of education, crime prevention, therapy canines, and mental health. The Urbana PD model is one of follow-up, specifically for mental health, substance abuse, and homelessness. Our plainclothes behavioral health detective and Rosecrans clinician do not receive direct dispatches from METCAD. Instead, uniformed UPD officers, as has always been the case, respond to crisis calls, and they attempt to triage the incident while at the scene. After the patrol officers author an incident report now, that report is then routed to the CCRT team for follow-up within 72 hours. This program is something that the city could afford at this time. The university, as you know, has several different avenues of resources, and I'm sure the COAST program will be successful in its own right, but I wanted to clarify the differences of the two models. Now, after the CCRT analyzes a report forwarded by the patrol division, they research previous reports in regards to the individual that was in crisis. And they attempt to locate a support system, namely family members. And then Paige and Shelby reach out to the individuals that had the crisis moment to see if they're taking part in any services locally, or if they need to be steered in the right direction of what services are available for them. The goal is to reduce the number of interactions with police by providing linkages of services and to increase their quality of life. Now, Detective Bennett, as you know, received specialized training through the University of Illinois Police Training Institute and members of the School of Sociology entitled Academy for Social Work and Public Safety Cooperation. This was a 40-hour course just before the implementation, and some of the topics included non-escalation, de-escalation, evaluation tools, confidentiality, and scenario training, just to name a few. So without further ado, I'd like to introduce Behavioral Health Detective Bennett to introduce herself. Paige.
Thanks, Lieutenant. So my name is Paige Bennett. I've been with Urbana Police for about 4.5 years now. I got interested in police work after I completed an internship here for my bachelor's degree from the U of I in social work. Some of the roles that within the 4.5 years that I've gotten is this behavioral health detective role, a crisis intervention officer, a hostage negotiator. I also got my master's degree in social work with a concentration in mental health. And right now, on my off days and whenever I have time available, I'm working on my clinical hours to get my LCSW as well. And I work with Shelby Moreland. Shelby, you can go ahead and introduce yourself.
Thank you, Officer Bennett. My name is Shelby Moreland. I just recently started at Rosecrans. I came over to Rosecrans to help launch this program with Officer Bennett and Urbana Police Department. My history is I graduated from Olivet Nazarene University with my bachelor's degree in social work with a minor in nonprofit business. And then I graduated from the University of Illinois with my master's of social work with a concentration in leadership and social change. Prior to coming over to Rosecrans, I've had previously worked the past 5 years in mental health, specifically in an inpatient psychiatric hospital, as well as an emergency department providing crisis services, as well as working in other areas of mental health services. Thank you.
Okay, Melissa, did you want to introduce yourself since you're with us as well?
Sure. Good evening, everybody. My name is Melissa Pappas. I am the CCBHC Implementation Manager for Rosecrans Central Illinois. Basically, my role for Rosecrans is to implement all of the programs that we're receiving funding under the CCBHC federal grant. The CCRT, which we're talking to you about today, is one of those programs that the grant is funding. I began my career in community substance abuse treatment. I worked many, many years in the Illinois Department of Corrections as a licensed clinical professional counselor. And now I have my role as the implementation manager at Rosecrans.
Thank you, Melissa. I'm going to share the screen here and show a PowerPoint presentation. It's a few slides. So Melissa, Shelby and Paige have been quite busy since the implementation. They've made or attempted to make contacts on 110 occasions. Of those individuals they came in contact with, 34 were identified as potential clients. And those individuals that we made contact with came from the original presentation of the individuals who had a high number of police contacts. There were 77, I believe that number was. They were identified as 26 CCRT clients. And what had occurred was 13 of the clients was with closed cases. People either declined the services for follow-up or linkage, or they were unable to be located after the original crisis call after 3 attempts. So each report that we get and each individual that we want to have a conversation with to provide some linkages get at least three attempts. And they do that by going to their last known address, any phone numbers or any areas. And also Shelby and Paige have been known to drive around in certain areas for individuals who may not have a home to look for them as well. So there's 13 clients with open cases. So 4 of those clients already had documentation and engaged with mental health providers. 3 clients referred to the Rosecrans Criminal Justice Program. And Shelby or Melissa can touch on that if you have questions regarding that. But 4 clients were referred to Promise Healthcare, which provides psychiatric and counseling services. And Promise does accept insurance, but they also accept Medicaid and non-insurance individuals. 2 clients were referred to other counseling service. I believe one of those were to Carey Powell Counseling and then the Elliott Group Counseling Service. Some of the demographics of the 34 potential clients, 19 were white, 15 were Black, 14 represented the male population, while 20 represented females. Of the active clients of the open, currently 7 individuals are white, 6 are Black, 7 are male, and 6 are female. Now, I wanted to give Shelby and Paige an opportunity to tell you some information here. So I don't know who wants to go first. Paige, would you like to say a few words?
Sure. So I chose 2 clients that we are currently working with that have really stood out for me within the past 2 months that we've been working. Client number 1, she's a young female, lives on her own. She was one of those 77 clients that police were getting called to often by herself and for like domestic issues, things like that. Upon initial contact, she was very open to seeking psychiatry for medication. She had been off medication for a while, and she didn't really even know how to access psychiatry in Champaign-Urbana. So we got her linked to Promise Healthcare, and then we also linked her with criminal justice team. And through the criminal justice team, she was able to do some anger management classes, got linked with housing options and case management. We continued to work with her. She would call us, I would say weekly, if not a couple times a week. She told us, you know, you guys are the only ones who answer the phone. I try to call doctor's offices. I try to call counseling services. Nobody follows up with us or with me. And you guys are my only people that listen, basically. So it was nice that she calls us in times of her crisis or, you know, just having a bad day instead of calling 911. So that reduces the numbers of 911 calls for her. We were able to get her a bus voucher and it increased her job opportunity. She was able to get 2 jobs based on the bus voucher. So that was amazing. And she's really doing very well. And then the next client, she is a older homeless female in the community. She doesn't want our services for like homelessness things. That's because she has severe mental illness and doesn't think that she is mentally ill. Within the past 2 months, we've been able to get her an ID card. We have worked on getting a copy of her birth certificate, which is pretty difficult because she doesn't know a lot of information, or what she tells us, there's no way to really verify who her parents are, things like that. We were able to attempt to get her into housing through Section 8. We're still working on that. It's pretty difficult. as well as Social Security benefits. Something that was awesome is that we found her son who lives in Wisconsin, and she hasn't seen him in at least 11 years. He tried to track her down, but due to her being homeless with no phone, no internet access, anything like that, and him being out of state, he said he just lost track of her. We were able to do a couple of video calls with him, and it just meant the world to both of them to be able to see each other. So we're hoping that being able to link them together, maybe we can work out a housing option for her. And this was really all possible because Shelby and I can spend hours trying to research and find people and link them to services rather than 30 minutes and then you have to go to the next call, which is what patrol officers have to do. You don't always have time to really work what you can. So, Shelby?
Thank you. I'm also going to share two of our clients as well. So my first one is a young male. He still lives with his parents at home. During Officer Bennett and I's first interaction at the home, the mom answered the door and she was really just present for the whole interaction. And just like numerous times throughout the interaction, she was telling Paige and I, you know, you guys coming out to the home, you guys being here, asking him how he was doing after he was having suicidal ideations, that just makes me feel like my son matters, that my son is a person and that this community really does want to do something for him. Paige and I were also able to successfully link him into Elliott Counseling for counseling options, as well as they have a nurse practitioner, so he'll be receiving some psychiatry support as well. But it was great though in his interaction to not only see how he interacted with Officer Bennett and I with our respective roles, but how the family also was just like ecstatic to have our presence there. And then my second client that I wanted to share is a young female. She also resides, she has her mom in the home as well as her maternal grandmother. She was a client that we selected off of our list of 77 that we came in when we initiated the program. She was also someone who was very like, yes, like I want to be back on my medications. I want to have a counselor. I want to have a job. I would really like to get out of my family's home and be successful without having to depend on all these other people. So we were able to get her. The nice thing was she has already been a client before at Promise Healthcare, so that was a very smooth transaction to get her back into psychiatry as well as counseling there. For her, we also were able to obtain a bus voucher. So that really just increases her willingness to engage in those mental health services, being able to attend those appointments and not being reliant on someone else for transportation, as well as she was able to gain job opportunities from having this voucher. So not dependent on another person to be able to drive her to these places, but for her to really have that dignity to be able to do these things on her own. And this was something that she wanted to do, but she had the lack of access to both of those resources. So it's really nice. Paige and I have been really working not only with our community members, but also these organizations to know who our contact people are, to quickly be able to get a bus voucher for someone, making those connections with our mental health providers so that we can get those referrals in, and identifying who are our seriously mentally ill clients, and be able to advocate for these people more than that they're able to advocate for just knowing that that's their need. So those are just some success stories that we wanted to share today.
Thank you, Shelby. Mayor, Council, this concludes our presentation. So we'll take some questions if anyone has any.
All right, questions. Sharice?
Hi. It sounds like things are going, when I compare to a year ago, a lot better than a year ago. I have one question. What exactly does the criminal justice team do?
Melissa, do you want to answer that, or Shelby?
Sure, of course. I will go ahead and answer. So our criminal justice team at Rosecrans is specifically designed to work with individuals that are within the criminal justice realm. So whether they've had police contact, been arrested, recently gotten out of jail, even recently gotten out of prison, these individuals are provided with services and often do a lot of the communications with probation, parole. So they offer things like anger management, they offer case management services, those types of things. So that's kind of our criminal justice program at Rosecrans.
So if you have a client that did the full time and they come out and they don't have a parole officer, they don't have, are you engaging with people like that as well?
Yes.
Okay. All right. Thank you.
Yes.
All right. I believe Grace was next.
Thank you. Thank you guys for the presentation. Some of my first questions were just clarifying the presentation. I don't know if you go back to the slide or just remind me that sounds like you had 26 clients out of 34 potential clients out of, I saw something of 109. Is that the total number of people interacting with police since this started October 11th? Or could you explain those numbers to me again?
Sure, I'll pull it back up. I actually emailed the council and the mayor the PowerPoint presentation for your perusal as well. Is this the area you were speaking of?
Yes, 110.
Sure. So there was 110 attempts to speak with individuals. So that's just the documented times that Shelby and Paige went out and tried to reach out to individuals and identify potential clients.
Out of the same 34 people, there was 110 contacts, or is this 110 individuals?
No, not 110 individuals. It's just 110 times that Paige and Shelby went out. They try to go to one individual at least 3 times before they either consider the matter closed or unable to find these individuals. So there's a lot of legwork involved in trying to track people down who might be homeless or who might have moved or is kind of living in between houses.
Okay, so it was 110 times that they attempted to contact these 34 people, and 26 of them became clients with 13 open cases. Is that right?
Yes. So that's this list here, where it shows that 13 refused services or they were unable to be located. And then the other 13, their dispositions are on the right-hand column.
Yeah, and then 9 referrals essentially out of that. Okay. And I was also wondering, there was, I'm sorry, maybe this was Officer Bennett that said that people would call, in the story, that people would call them weekly, that people would call us weekly. And I'm just wondering, who is that? Is that like this CCRT team? Is there a direct crisis line that people are calling instead of 911? Like, is that only for your clients? I thought this was kind of a referral thing. So I don't know if you could explain people calling directly and how that works.
Sure. So I have a direct line through the police department that is our CCRT phone number that we give out to clients who may, even if they don't want any services, we obviously give them our number and contact information if they later decide that they do want services, and we can work it that way. This is specifically just for CCRT, and it comes through my cell phone, so we can really talk to these people any time of the day that they need to call.
And so is that for the 26 clients, or is that something available?
That's for anybody. It's a public number. It's for anybody that needs help.
And that is for calling, looking at resources more, or is there a physical response associated with that? I guess what kind of things do you do, or can you do?
I guess it just depends. If one of our clients calls us and they're in crisis and we have time available that we can go and speak with them and deal with it in the moment, then obviously that's what we want to do. But sometimes it is just looking for resources or needing to like reschedule appointments, things like that.
Thank you.
All right, Grace, are those all your questions?
For now, yeah.
All right, Chandra?
Hi, so thanks for the update. I have a couple questions. So going back to the 13 who were declined or unable to locate, would it be possible to break that down even further? Like, I wonder how many were unable to locate versus declined.
Paige, could you answer that? One of the things that I did send in the email is if there's some data that you'd like to see that we can try to implement, we'd be glad to do that as well. So go ahead, Paige, sorry.
I'm sorry, I didn't hear the question. I had a audio malfunction there for the question. What was the question?
I was asking about the 13 that were declined or unable to locate. Could you break that down more specifically? How many were unable to locate?
I don't know if I have that exact number, but basically it's anybody that we can't locate due to either maybe being homeless or they're transient or they gave an address that's actually not their address. Sometimes we go out and we have little door hangers that have our information. We put our cards in it and things like that that we'll leave. And then the next contact that we try to attempt, it's kind of nice. We can see if they've moved it or not. So if it is a good address or not.
Mm-hmm. Right. I'm just curious as to how many were unable to locate. And if you find that information, would you mind emailing it to me? That would be great. For sure. And then also my other question was about the referral process when of the 13 people that are in your client list. So when you say a referral, is there follow-up after they've been referred, and in what manner are the referrals done? Like, is it just like, oh, here's the number to Promise, or do you sort of like, walk them over there or go to their, see the whoever with them, or say like, this person at Promise is expecting your call? What does that referral process look like?
I'm going to let Shelby answer that. She does all of the referrals.
And actually, while Officer Bennett was answering, I was able to pull up my client database to do some more statistics for you. So we have had, of those 13, 8 of them, we've either unable to locate them because of a bad address, or Officer Bennett and I went to the home 3 times, knocked, left door hanger information with them, and had no response from those. And then it was 4 clients who refused services, but those 4 clients were the ones who were identified as already being engaged in services, and didn't need any other mental health treatment at that time when we offered to them. And then, so when Officer Bennett and I go to the home for the initial contact, or we have other additional contact with them, we offer them mental health treatment. We kind of identify what service that they would benefit from. So particularly for the Promise Healthcare ability to offer, they have primary care, psychiatry, and counseling services. So when Officer Bennett and I are offering that service, we have that referral packet in the car with us. So if they say yes, I hand them that packet. We offer to do the packet with them if they want, or if they want us to come back the next day, if they have any questions. We try to retrieve that completed packet within 24 hours so then I can submit it to Promise Healthcare. Promise Healthcare is probably the more like extensive referral packet. If they have private insurance, and I can get them referred to somewhere like Elliott Counseling or the Carey Powell, like we've stated before. Those are just phone calls that I'm able to make to those agencies. Typically, I'm providing them with a brief referral, and then that agency is calling that client back to schedule the appointment where it's a time frame that they're able to attend. Because I definitely don't want to schedule them something for 9 o'clock in the morning and they're like, I can't make it to that appointment. So ensuring that we give that client still the ability to participate in that referral process too, because our goal is to just provide this follow-up care, but providing them with the resources and how to access these services for when we're not present for them as well.
Okay. Thank you for that explanation and for breaking down that 13 number. So when they are, my last question, when they're referred, Is there a wait list? I know like psychiatry and mental health services there are wait lists all over town. Are they able to sort of be squeezed in more immediately, or are they placed on a wait list as well?
Definitely, that's a good question. So it kind of depends on the presentation as well. Some of Officer Bennett and I's clients are classified because of their diagnosis of mental health as seriously mentally ill. Those individuals do have priority for accessing services. So that's just something that I mentioned in the referral packet to make sure that they're in that top tier, getting to kind of surpass a couple people on a wait list. Where we're finding more so a wait list for is for individuals who are uninsured or on Medicaid. But we recently have been getting those individuals in pretty quickly at Promise. And then Rosecrans has hired a few more mental health clinicians to get them into counseling pretty quickly. I've found with individuals who do have the private insurance, we're able to get them those counseling appointments within a week.
Thank you.
All right, so forgive me, I don't know if Jay or Chris raised their hand first. So Jay, you're first on my screen.
I think it was Chris though.
Oh, okay, we'll go with Chris.
Thanks, Jay. Yeah, my question is for the chief and Lieutenant Coker. Could you maybe, and I know you can't talk about specific cases, but could you maybe for the public explain how your uniformed officers taking the 911 call or however they come in contact with people on the street, how they determine that we need to bring Paige and Shelby into this later?
Sure, that's a good question, Mr. Evans. NCCAD has a roster of all our officers' special abilities or education and training. Currently, we have 29 crisis intervention trained officers on the police department. So if an individual or information comes out that an officer needs to go because it's a crisis issue, some examples are suicide attempts, suicide ideation. You may get some different calls for service in regards to dementia or elderly problems, but a CIT officer is primarily dispatched. So that CIT officer takes point and tries to have a conversation and try to get to the root of the problem for that individual and see what that need might be. They then would author a report based on varying information. So if it came to the point where an officer had to use an involuntary petition because someone had harmed themselves or was in the access of doing that, that is an automatic report that an officer would author and forward, and that goes right to the CCRT for a double check, if you will. They can also go to take a regular call. Let's say it's a check welfare call, or someone wanted to speak with an officer to get some advice, and an officer may notice that something just maybe not be quite right. They can refer that individual either to CCRT through email, or a lot of times the Shelby and Paige are actually very near the patrol division offices. So a lot of times we'll get officers to stop in and chat with them about individuals who they may have encountered on the street.
One more quick follow-up question. Are we able to have a CIT trained officer on most shifts?
Yes, we do. Actually, let me hang on for 1 second.
While he's looking up that number, we have 29 CIT officers and we have 55 sworn positions. So that kind of gives you maybe a quick sense of the numbers there. But yeah, I believe, and he'll double check my math, that we almost always have at least one CIT person on each shift.
All right, Kaya?
Thank you for the presentation. It's very helpful to hear how this program is working so far. I really appreciate this information. I did have one question in terms of kind of from the client perspective. It's related to Chris's point. What are the expectations in terms of privacy and confidentiality? I was honestly surprised to hear as much as you all are sharing about your clients. So I think that residents of Urbana are right to know like what of their information might be shared, including in public spaces.
So as far as like HIPAA violations and things like that, confidentiality, usually Shelby and I are talking to a client together. So they have the option, if they want me to step out, then that's fine. I give them that option. A lot of times, actually, there hasn't been one that has had a problem with me being there during the conversation and my body cam is on. I mean, they know that they're being recorded. As far as clients, obviously, I'm not going to tell anybody's name or specific addresses or anything like that, or diagnoses.
But there doesn't have to be a waiver for other identifiable information, like that someone's a minor, that they're homeless, where their family lives, those kind of things. That's not something that's considered private information.
I would not share that with the public.
But you all did this evening. That's why I'm just asking for clarification.
I'm not sure exactly what you're asking then.
So I guess for my perspective, working in social services and other settings, sharing information that is specific about a client in a small community, you know, including someone's housing status, where their relatives might live, their general age group, that would be considered personally identifiable information. So I was just hoping you could clarify for the public who might be engaging with this program what the expectations around privacy and confidentiality might be, since you all did share some specifics related to your clients tonight.
So Jay, I'll see if I can help out a little bit with this one here. Maybe Melissa might be able to kind of help just a touch. I think tonight the point of what we tried to do, I think what was tried to do was to at least provide a flavor sort of what sort of is happening here with regards to privacy. I know, as a matter of fact, that the Rosecrans has actually separate databases. We try, and we don't collect a bunch of information on our side, because this has been part of the dialogue and part of the build on this project, so that we can ensure that, yes, that the privacy is respected. I don't know, Melissa, if there's something else you'd like to add at all.
I mean, the only thing that I would like to add is that, sorry if my internet is messed up, but although they were providing success stories, I don't believe any of the information provided today can definitely pinpoint a specific individual within the community. I think that Shelby and Paige still did a very good job at keeping the information still broad. But we definitely wanted to come here to share the success stories of the program, what the program is providing to the community, and how we are working together to provide these individuals with services and support that they did not have before this program.
I appreciate that. And maybe that's the answer in and of itself of, you know, obviously that personal narrative, those examples that you all are sharing are so impactful and powerful. And, you know, it's great to hear that folks are getting the support and the connections they need. But I think just clarifying for people who may come in contact with these services, that is something, if a waiver is not being asked for sharing information related to their cases, I think that's something the public deserves to know. So that's I think that's clarification enough for me. One other piece in terms of this program that I would love clarification on is, how does this program work compared to, you know, Rosecrans provides extensive crisis intervention services in our community, as well as case management. You know, there are lots of services, right? So a little bit more of an explanation of how are these folks not already getting connected to other Rosecrans services, or, you know, what is the difference compared to, you know, other instances where Rosecrans would be getting called in for services, whether at the time of a crisis or as follow-up?
I do. I think that that's a great question. So what kind of sets the CCRT team kind of aside from these other programs? And I think the best answer I can provide to you is that the CCRT team is showing us these group of individuals that we're missing, because maybe they are having the majority of their connection with law enforcement, that we are not getting that information. We're not getting those calls in a timely manner. And so what the CCRT team is doing is it is providing us access to a population of individuals that we might not have had access to until weeks down the line. And that could have been too late. And so what this is allowing quick turnaround. They had an interaction with law enforcement, 72 hours later, boom, we're doing a follow-up. And a lot of times it's not even 72 hours. It's more like 24, 48. So this is providing us access to a population of individuals that we don't have quick access to. So that's kind of what sets us apart. And also, there's no waiting list for CCRC. I mean, they're going out every single day and they're seeing these people and they're interacting with them and they're getting connected to these services that before it could have been a week or a month before we even saw them face to face. So it's that quick interaction, that quick engagement. That's what really, really sets them apart. And then that work with law enforcement, that kind of side by side, we are here to help, we are here to support both on the mental health side and the law enforcement side. I think that connection and that relationship is showing the community that we're here to work together, and we want to make sure that you are getting the best help that you can get.
Thank you.
All right. I think everybody's had a chance to ask questions that wanted to, so we'll do the second round and then we'll wrap it up after that. So Grace.
Thank you. Sorry, my cursor disappeared. Thanks for your patience with all the questions. Can I have clarification? What is the CCRT phone number that's available for the public then? And / I'm not finding it on like a Google search or the city's page.
Okay. And maybe that's something that we need to add on to the city page. Yeah, we can definitely get that done. So the phone number is 217-328-8282.
8282. Thank you. And you said that is a number that the public can call for mental health crises, for connections to resources and response, or is it certain hours? Okay, so let me back up. I have 3 questions and a comment that are really all kind of confusing. It might be easier to just take them all and then you explain it all. Because my understanding was that this was the follow-up model and not a real-time response. So I'm confused about why it was portrayed in the media that way in particular. It seemed like it was messaged to the public that this was a real-time response. And my understanding is that that's not the case. And then also been hearing about a new bill coming down where we will be required to have an alternative response for mental health crises. / are we moving towards that, towards a real-time mental health crisis model? Because story in my comment there is I think that we do need that. We need a separate number to call for mental health crises where people can get real-time help without necessarily involving police, or at least not primarily, not them being the only response. So I'm wondering if you could just clarify this whole situation a little bit.
Sure, I'd love to do that, Grace. Let me say this, and that was one of the reasons why when you talked a little bit about how the media portrayed this, that was one of the reasons why when we started tonight, we wanted to make sure indeed that Lieutenant Coker said, no, this is not. It's like a story locally that wasn't accurate and portrayed it as something it wasn't. So I think we've been very clear all along that this is a linkage follow-up model. And so that's why we led off tonight with that particular comment. With regards to a real-time response, it is not a real-time response unless the team happens to be walking out the door as they're maybe getting the patrol officers getting dispatched. The number is for follow-up. The number is that they have for follow-up. If someone is in crisis, there are other avenues. This number is to kind of keep those clients coming and directing them away from dialing 911 when they have a specific need, like I need help getting my bus pass. If there's absolutely an emergency, dial 911. But that's not the purpose of this number, should not be advertised as if you're in mental health crisis, dial this number, because these 2 people can't work 24/7, 365. With regards to the new law that's coming out, it's rather extensive, and it is going to be a while in the making. I've seen a variety of different people posting certain things that January 1st, this must happen. That is not the case. I think ultimately the goal for the state of Illinois was to try to come up with mobile crisis units that can handle these types of things. And I wouldn't disagree with your assessment at all that that might be a good way to go. That's going to require a build out, and that will require, I would imagine 12 to 18 months till they get to that point. The state of Illinois is sort of divided. There's going to be a state board. There's going to be sub-regional boards. And I'm not even sure those boards have all had their, the people who are going to be seated on those boards even named yet. So that will continue to build. But I think there's an opportunity for us to get some work done as that process is going. I think they can run together. And I think I got all three of your things.
Well, I guess, Marty, do you feel like this is helping move in that direction? Like we are learning that collaborative piece? I feel like that was kind of how I interpreted the original presentation of this, was working towards that being the ultimate goal. And I'm wondering if that is the case, that this follow-up model is helping be a step towards a real-time response model.
Yes. I feel that way.
Okay, and is there anything concrete about it, or just like the learning experience, or?
Well, I guess I'm not sure exactly what I think that's sort of why we wanted to show tonight. I think I wanted the people to within the city to see the people who are here, to see those that are going out, that have knocked on 110 different doors or whatever their exact efforts have been. So yes, I think that these two here, as we've worked with Melissa and the team at Rosecrans and with Carlene, we've been able to absolutely positively collaborate and work together. And we try this, and as we work on this, maybe in another year, we're like, okay, we got a better idea, and we think this is it, and Champagne's tried this, and if we push these things together, again, remember this was sort of born out of the big idea of one door, okay? And it was a huge, big lift. And so I think what's happening is, as people stand up little components of this, indeed, we see how maybe these can work together. And one of the things that I will say, for those who have seen live action models, real-time response that everybody praises, one of the downfalls is, and the follow-up isn't quite there. And so I think what we're trying to do here is show, that's going to take both components. And this is one that we thought we could get stood up and rolling.
Makes sense. Thank you for clarifying. And I think that's true. The follow-up is important. And also the real-time crisis response is important. And I think calling it crisis co-responder team does give the impression that this is a real-time co-responder while people are in crisis kind of program. So I appreciate this work. I think it's great if you can connect people to resources to get the help they need and feel like they have the support. I think that's great. I think there's still a population of people who are in mental health crisis who don't have someone to call when they are actually in crisis at that time besides police. And that is a huge need that I think we need to address. And I hope that this can help be a step towards that. And I also just want to say that I echo with agreeing, and it sounds like the answer is no, that people's information like age, housing, behavior stuff is not considered confidential. I just want to be clear on like an answer for that. And I definitely get what you guys are doing and bringing some light and kind of humanizing and exemplifying it. But I do agree that especially in a small town, it's kind of hard because I kind of have guesses or ideas of who you're talking about with that information. So I think that it can be more identifying than one would think. And that's all for now. Thank you.
So just a note, Grace, I don't know if you read the police media reports, but address, age, sex, all of that is released in our police media reports for every single police interaction. I'm assuming that the interactions that that Paige and Shelby are doing are not part of those police media reports. Frank, can you confirm that?
I can. That's correct.
Okay. All right. But just in general, all other police interactions are reported out.
They are, but I do believe that they indicate the 100 block number as opposed to a specific apartment.
Yes. Yes. Unless you indicate a business name. Sometimes a business name is there. Yep. Yep. I think Chandra was next.
Hi. So I heard Officer Bennett mention her body cam. Is she wearing her body cam in these interactions with clients?
I usually am wearing my body cam during interactions, and I let them know that I'm wearing my body cam if they would like me to turn it off within the privacy of the residence, or just doesn't want the conversation recorded, that I can turn it off if they request that.
So are you wearing your I don't know, your uniform, your patrol uniform? Or
Nope,
just
this is like what I wore today.
okay. Why is the body cam in a featured component of the interviews?
Because it's still a policy that I have to abide by.
Also, one of the reasons is in the event that Paige is interacting with Shelby and a potential client, if something were to be addressed outside needing a law enforcement response, she would have that tool readily available, as we would want her to have that.
Okay. And then one last question, like we were talking about the future of this program and, you know, learning things from it. The 8 people who are, you know, you sort of lose to that unable to locate group. I'm wondering, I think that's sort of the flaw in the follow-up model, but is there, I guess, I'll just leave it there, but I think that's sort of the flaw in the follow-up model, and perhaps there could be some, you know, thinking around how we can start to minimize that, because if that's sort of like, you know, 60% of the people you're missing, those are probably the ones that may need the most help, who need to be more aware of the resources. So I think that's all. Thank you.
And I do think that is a great comment. And if I'm sure that if you ask Paige or Shelby, it is our goal to get into contact with everyone, but they do multiple attempts at trying to contact these individuals. It's not a one or done. So they're out there hitting the pavement, trying multiple times to track these individuals down. And there comes a time where their attention needs to go to the next individual.
Yeah, I totally understand that. I just think like we have to think of a model or some sort of patch to get those people before they fall through the cracks.
Chris?
Yeah, Chandra asked one of my questions, but real quick, Paige and Chief and Lieutenant Coker, you can jump in if you want. Paige, are you wearing weapons, and are they displayed so the people can see it on a follow-up call?
So I do wear my badge and my firearm, and then I wear a bulletproof vest. So, but not on every follow-up am I wearing my bulletproof vest. It kind of depends if this is an initial contact, or if I'm going out for the day, I'll wear it for that. But not every single time am I in a place where I can take it with me or whatever to wear, because we do meetings with different departments, organizations, things like that. But yes, I do wear my gun and my badge. Sometimes I have a coat on so you can't see it, but during the summer, yeah, you would be able to see it.
Thank you.
All right. Diane? You're muted.
I just wanted to thank Lieutenant Coker, Officer Bennett, and Ms. Moreland for the enormous amount of work that they have done in just the past 2 months and the progress that we've made. As we said, it's a learning experience. We'll learn as we go along. But as you heard, the big difference with this program is people have time. Typical officer encountering a person in crisis does not have the time either at the moment that they encounter a person or even for follow-ups. So this buys us some time and buys us the opportunity to actually help people and provide more services. So we'll learn a lot from this as we go along. And I just wanted to thank these individuals who have put an enormous amount of work into this program already. And I'd like to express appreciation to Rosecrans as well for making this possible. Thank you.
All right, well, thank you. I'll just echo the sentiments of my fellow council members. Thank you very much for coming tonight, giving us this update. We look forward to hearing future updates, and we wish you well and a Happy New Year.
Thank you very much for having us. If the council and the mayor would approve, I can have a updated report on the third Monday of every month to show you the previous month. Would that suffice?
That would be fabulous. Yeah.
We'll plan on that.
Great. All right, next item on the agenda is public input. So at this time, if you wish to address the city council, the committee of the whole, please raise your hand. And if you're on a phone, I think there's one person on a phone, I believe it's *9 that you can press that raises your hand. So the first person up is Reverend Dr. Evelyn B. Underwood. Dr. Underwood, you are muted.
I did unmute. Did I
can hear you now.
Oh my God. I've tried for so many weeks to get on, and then you make me first tonight, and I'm not ready because I was too busy taking notes from the last presentation.
Would you like to talk after the other two people, Doctor?
Yes, please.
Okay, all right, that's fine. Thank you. All right, Alan Max Axelrod.
Hi, can you hear me?
Yes.
All right, so the last time that I spoke to this city council, I read section 10 of the Stephen Edwards Watts Act. You'll note that it doesn't mention the word dispatch. So I find the pussyfooting around that to be, well, I'll read you what a disabled legislative expert had to say when I get there. Section 10, applicability home rule. This act applies to every unit of local government that provides or coordinates ambulance or similar emergency medical response or transportation services for individuals with emergency medical needs. A home rule unit may not respond to or provide services for a mental or behavioral health emergency, or create a transportation plan or other regulation relating to the provision of mental or behavioral health services in a manner inconsistent with this act. This act was pushed after Stephen Edward Watts was killed by police. The intent of this is to have no involvement of police for a subset of criteria of behavioral health calls. You'll note that the broad language here does not use the word dispatch. It's like you looked at section 30 of this and saw that the prohibitions had to do with dispatch. And so you thought that if you could just get around the word dispatch, that it somehow allows you to do this. It does not. 12 days of Christmas. You got 12 days to come into compliance with this. Here is what the disabled the disabled legislative expert said, who talked to the author of the bill, Kelly Cassidy. Kelly says that this is all just wankering on their part. The regional task force will govern the rollout. Probably fine to spend a little energy calling them out high for trying to waste taxpayer money and resources just to make sure cops are involved, but it is unlikely to remain in place in actual implementation, it sounds like. Point is, they anticipated shenanigans and built it into the bill. If there's a legal challenge, it will be Urbana having to challenge the discretion of the regional task force. And I'm guessing that it won't go well for them. They might be able to throw money at friends. That is from a disabled legislative expert who's testified to Congress. And we have seen in past, y'all get things disastrously wrong when it comes to legal interpretation. I'm sure your new legal counsel will have a better track record than your previous one. However, this is a big blemish on that record. So, anywho, I just want to say that it's not the fault of the workers that the politicians had y'all doing things that are going to no longer be permissible in 12 days. Again, nowhere in the applicability that actually restricts municipalities from leveraging home rule capacity to deviate from this act does it say deviate or dispatch. services. It says provide. So, you know, it was a pretty genuine effort to try and maintain a service in place of no services being there. Like, I will grant that. But the reality of the situation is that you as a municipality are trying to go for this exceptionalism where you somehow know more than the authors of this bill. You somehow know more than the disabled legislative expert who has been part of the group that has pushed this for 10 years. So, I mean, if that's the case, I look forward to y'all proving that in court. Have a good day.
The next person up is Brandy. Brandy, can you state your full name for the record?
Yeah, my name is Brandy McCoy. I'm an Urbana resident. I'm commenting on the CCRT as a program that can be detrimental to the mental health of individuals the program aims to help. Poverty is criminalized on a local, state, and federal level, and poor people are subsequently traumatized by police officers, something I'm familiar with on a personal level. Many people who receive a visit from CCRT will be at risk for re-traumatization by the presence of a police officer in this social program. I find it questionable at best that the individual who spoke for Rosecrans at the public hearing for this program on October 4th said police presence was necessary to protect her employees. The assumption that someone who called for help days ago is inherently dangerous is not one that belongs in the mental health field. This in itself serves as an example of how our structure of policing is at odds with a structure of trauma-informed mental health care. Sending an armed officer for this purpose is absolutely unacceptable. I do appreciate the notion of providing additional engagement and services to people in need, and I do agree that more access to mental health resources is necessary in our community. But police involvement is counterintuitive to mental health programs, and CESA is a clear indicator that legislators are beginning to understand that fact. Programs like this may swell with wholeheartedly good intentions, but we must consider the potentially harmful impacts despite those intentions. I emailed an article that I spent weeks researching and writing, and I hope everyone on this council takes the chance to read the detailed explanation of how police traumatize impoverished populations and how that trauma will negatively impact the success of social programs. We must establish strong mental health infrastructure, and we must do so without the involvement of police officers. Thank you.
Thank you for your comment. The next person up is SN. Can you please state your name for the record? You are unmuted, but now we can hear you, Sarah.
Okay, great. Yes, SN is Sarah Nixon. I'm just trying to organize my notes. So I think this proposal is a really good start, especially compared to what we had a year ago. But there are, or it does raise some big concerns from the public's perspective. And ones that I can speak to would include the issue of domestic violence and child abuse. And I was just dismayed to hear no mention, no consideration and no references to that area of crisis. Which invariably also involves a mental health crisis for at least one, if not several people involved. And the second area that I can speak to is, or that I want to speak to, is privacy and confidentiality issues. I'll start with confidentiality. So I come from a city of approximately 6 million people in a huge metropolis. You could perhaps give a presentation like was given tonight and maybe not worry that you are oversharing confidential and sensitive details. But I was truly shocked and stunned by the amount of detail that was shared it was personal, it was identifying, it was sensitive, it was private, it related to people's specific health situations, family members, you know, home, where they come from. Urbana-Champaign is a comparatively really tiny community, and if you narrow it down further to people who are, you know, engaged or involved with the police or the mental health services or criminal justice system, it becomes, as one council member just noted, it becomes pretty easy potentially to realize who is being spoken about. So I hope going forward, I just want to say it would inspire a lot more confidence if when people are invited to city council meetings to give public presentations, that they would be extremely mindful to not provide narratives that go into such personal detail in profiling individuals. I have so many more comments to offer, and with only 1 minute, I won't be able to. I won't be able to cover all of them, but I want to mention also real quick, the body cams being on. That it feels like there's something wrong about that, because here we have police officers in a crisis response situation merging with into a mental health situation, which is commendable. This is what we're asking for. But I think in a mental health scenario, imagine walking into you know, a consultation or a session with a therapist. They would never have a body cam on. It is I think inhibiting to well, I won't go into speculation, but I think that should be thought through, perhaps better thought through, and I will just try to compile the remainder of my comments and try to offer them another time. Thank you for your time.
Thank you for your comment. Dr. Reverend B. Underwood, are you able to talk now?
Am I unmuted?
You are unmuted. We can hear you loud and clear.
Great. I've got to start. I was taking notes. Plus, I'm in mourning. I did not get an opportunity to attend the last of the meetings that you had at ILEAS, the goal setting. I was there at the first two, but I had someone in the hospital very ill. And I guess I should go back to the most important thing that I wanted to say. But I was a little late getting to the first meeting, and the second meeting was a continuation. And so individuals were not allowed to speak. And the last one, I don't know if there was a continuation, but my friend was in the hospital, a church mother, very, very ill, and she's since passed. And so we are mourning right now. But what I wanted to say, and I think this is the most important, I took a lot of notes from this, and I've been listening to other city council meetings that I haven't been able to speak. But I think the most important thing I need to say to Urbana is that everything we do, we should do it looking through the lens of equity. With our policies, goal settings, and everything that we do. If we look through the lens of equity, I think we would go far in Urbana in being a fair and just community. I really listened tonight, and I don't want to go into detail, but if other people were listening through the lens of equity, I think they'll see that there's a need in this community. I don't want to call names, anything like that, but I should be able to comment on different things, because I was upset the time, and I sent an email, and no one has ever spoken to my email that I sent to the entire council about the fact that I was accused of attacking an individual. And what I actually did was talk about the individual's comments that were made. And we should have a right to do that. But if we can look through the lens of equity in our policies and all, and I know, and I'm trying to do a little research on this now because I'm getting information that the governmental agencies nationally and other social agencies like United Way nationally, I don't know yet. I haven't checked locally to see if they're doing it, but looking through the lens of equity. And I think that's important. So I'll stop with that. Thank you.
Thank you for your input. I don't believe there are any other people in the waiting room to address the committee of the whole. Does anybody have a particular email correspondence that somebody had asked them to read at tonight's meeting? All right, seeing none, we'll move on to staff report. I know that Diane has a staff report, so let's go ahead and start with that.
Okay. Just an announcement, one, that the city offices will be closed for holidays on Friday, December 24th, Monday, December 27th. There's no council or committee meeting on the 27th. City offices will also be closed on Friday, December 31st. The next council meeting will be on January 3rd, 2022. I'm happy to announce that the grand opening for Sakura, which is the Japanese restaurant that you approved a liquor license for just last week, is expected to be in about a week or so. So that's very close, and keep your eyes peeled for when that actually happens. We're looking forward to that. I wanted to let the public know that there was a briefing this afternoon presented by the hospitals, the Carle Health System, OSF, the University of Illinois, and the Champaign-Urbana Public Health District. They reported that the hospitals are experiencing a very large surge of COVID-19 hospitalizations for Carle, the local facility here in Urbana. It's the largest since December of 2020. They have over 100 COVID patients in the Urbana facility alone. OSF reported that they had 279 COVID patients across the 15 hospital system. This is a huge increase compared to what they had, for example, in this summer. What the administrators of these hospitals wanted to let us know is that this surge is the Delta variant. It's not Omicron. So we're seeing the Delta surge, and they expect an impending surge for Omicron in the coming weeks, especially after the holiday gatherings. As in the past, the majority of the COVID patients in the hospitals are unvaccinated, and most of the breakthrough cases are among those who have an underlying health risk or are immune compromised. The thing about the Omicron variant, it's doubling every 2 to 3 days in other locations, which is a much higher rate than we've seen with other variants. So we need to be preparing for that appearing in our own community. The administrators of the hospitals are urging everyone who can do so to get a booster. It'll offer additional protection against Omicron. It's not a complete 100% guarantee you won't get COVID, but it will help reduce the severity of the disease. We announced that the U of I is going to hold the first week of classes remotely, and that will give them an opportunity to test every student twice when they come back to campus. Based on their past experience, they've learned that when the students and faculty staff have been gone for a while, that's really a key to success, is to be able to do the testing and isolation before they go back to in-person learning. And as far as advice for people who are gathering for the holidays, it remains: wear your mask, gather in places where you can distance. Do as much ventilation as you possibly can, which means keeping windows and doors open whenever possible. Sitting in household groups when eating and drinking, If you're immune compromised, if you're in an at-risk group, limit your exposure during holiday gatherings. And the public health district recommended that if you are going to be gathering with family members, friends from other communities, rapid test immediately before gathering, and then test again 3 to 5 days after gathering. This is all in our efforts to reduce, I'm sorry, I'm losing my voice. Hang on a minute. This is all part of our efforts to reduce the spread of COVID in the community, to support and protect our healthcare system, to continue our efforts to provide essential services from the city point of view, and to support our residents and small businesses. So we're asking everyone's cooperation in the coming weeks. And again, the most straightforward, simplest thing for people to do is get vaccinated if you're not, get boosted if you're not. Thanks.
All right, any other staff reports this evening? I guess, Grace, did you have a question for Diane?
Yes, I didn't know if this was appropriate time for staff questions.
If it's, yeah, go for it.
Okay. I was wondering if there was a brief update about the request for proposals for the community safety review, if we had like an expected date on that release.
I don't believe that I've received the scope of work. Did you send that to me and I missed it?
I believe so. Do you want to speak on that, Chandra? Or?
I thought that I had sent it to you, Carol, but maybe I did not, and I will send it to you tonight.
Okay, so I can't answer that until I see what I have.
Okay, thanks. Yeah, glad we cleared that up. And then my other question was about an agreement with Buy Black Chambana. Thank you for the email, Carol. And I wanted some clarification because it sounds like you're saying that you're waiting for Buy Black Chambana to become a nonprofit. And I don't know if you're working on new information, but that's not where I left my understanding of that conversation. I thought that we were working with her as a for-profit with an exchange of services.
Well, what I tried to explain in my email, so let me just try to paraphrase it. Buy Black Chambana is a for-profit business, and when the city of Urbana contracts with a for-profit business, that is for a specific item that we're purchasing or for a specific service that we're purchasing. So at present, and we don't do that through a membership vehicle. It's like if there are things that are provided by Black Chambana if you become a member, and those are typically things that a business would find useful over the course of, say, a year. But to the extent that the city requires those goods or services, so in this case, it could be advertisement, it could be sponsorship of a particular event, it could be training that she offers. We would buy that as a discrete purchase, and staff members are aware of Buy Black Chambana and that they can avail themselves of those discrete services or purchases if they should need such a thing. So if we need to advertise something, for instance, then we would purchase a discrete ad. However, if they were to, if Buy Black Chambana were to become a nonprofit, those are the kinds of organizations that we have these more kind of these agreements with, where a partnership agreement. But that's not typically something that we do with a for-profit organization. That's a business.
I understand that part. I guess I don't understand what the holdup is then, why we can't do a payment for services like she did with Champaign. I think she gave us the example that the city of Champaign contracted payment for services with her, and she had a certain number of workshops specifically for Champaign businesses, and then also the city bought a certain number of consulting hours that she gave Champaign-owned businesses. So I guess I'm not understanding if you're saying that.
Grace, it sounds to me like this is a longer conversation than we can handle in a committee of the whole. So I'd like to ask that you and Carol and perhaps Sheila talk at another meeting to understand some more of the nitty-gritty details. All right. Are there any other staff updates? Okay, the first item on our regular agenda is ordinance number 2021-12055, an ordinance amending Schedule H of Section 2393 of the Urbana Local Traffic Code requiring stop signs at a certain intersection in Deer Ridge Drive at Mark Trail, Lexington Drive at Deer Ridge Drive, Vernon Drive at Deer Ridge Drive, Horizon Lane at Deer Ridge Drive. And this is Public Works. I don't know if Tim's going to be presenting on this.
It's going to be me, Shannon Brannick, the city's traffic
thank you,
engineer.
Shannon.
So,
yep.
All right. So I was here, I think in June, very similar situation. I have several stop signs down in the Southridge subdivision. It's a pretty much exact same situation. There are several T intersections, and the normal rule of driving is if there's a T intersection, the leg of the T that basically dead ends is supposed to yield. That's, you know, how driving works. However, it doesn't always happen. So we got some complaints down in Southridge, and when this happens, what we do is we determine basically what's the through street. So in a T intersection, the through street's pretty easy to determine. It's going to be the one that's not the final leg of the T. It's the one that goes straight across. So in the case of Deer Ridge and Mark Trail is the through street. In the case of all the others, Deer Ridge is the through street. So basically what we're going to do is just put a stop sign on all those bottom legs of the T, and that's pretty much it. Are there any questions? This was approved unanimously through Traffic Commission, which is me, Chandra, and Rich Circles.
All right, questions for Shannon? Sharice?
Hi, Shannon. I was looking at the picture. I see what you're talking about, but I was also wondering about the streets at the end of where Myra Ridge is, and that is that going to, are there going to be stop signs possibly put there too, or?
Those were the ones that came through last time. So those are already there.
Okay, so they're already there.
Yes.
All right. Thank you.
All right, Grace?
Thank you. That was one of my questions Sharice already asked. Yeah, remembering that I thought those were some of the last ones. I will just, well, I guess it's question, comment. Should we get a motion? Do you care first?
It's questions for staff, and then if you have a comment, then we can have a motion. But do you have any questions for staff right now, Grace?
Kind of. It's hard to discern question, commenty thing. Okay, I'm still looking at the intersection of Trails and Myra Ridge, and I'm just wondering your thoughts if you still don't feel like that intersection qualifies on like B and C criteria.
So that intersection has already been studied in the past 5 years, and the standard rule of procedure for Traffic Commission is if something has been studied within the past 5 years and there's been no significant change within those 5 years, we do not restudy it because there is no warrant to.
I see. And what do you call significant change?
A significant increase in traffic, maybe a change in bus route. Right now, nothing in that intersection has changed. There's been no increase in crashes. The bus route has stayed the same for many years. There's really been no change to the intersection whatsoever.
All right, any other questions for staff? If not, I will entertain a motion. Sharice?
I'd like to move for ordinance number 2021-12-055, an ordinance amending Schedule H of Section 23-93 of the Urbana Local Traffic Code requiring stop signs at a certain intersection, Deer Ridge Drive at Mark Trail, Lexington Drive at Deer Ridge Drive, Vernon Drive at Deer Ridge Drive, Horizon Lane at Deer Ridge Drive, be moved to City Council for approval.
You want that on the consent agenda?
Yes.
All right, is there a second?
I'll second.
All right, moved by Sharice and seconded by Chandra. Discussion. Grace?
Thanks. I appreciate your insight on this and look forward to another review on that intersection. I will just say again, I think that there has been some significant change, I guess, depending on how you call significant, with Trails in Myra, with that whole new subdivision development. I think there is more traffic because there is a lot more neighborhood there that's using that thoroughfare. And there's also a tree that's growing in that intersection. I'm not sure when the last one was. I understand your system, so if that's what you guys feel appropriate, I'm looking forward to whenever its next time is after 5 years to review it. But I really think that that intersection needs a stop sign. I think that it's going into the right of way, the thoroughfare at Myra Ridge, and it is now one of the only unsignalized intersections of Myra Ridge that it's the only street that doesn't have a stop sign crossing it. So I think that it meets that kind of criteria. There's a big old tree, and I think there's some pedestrian safety concerns, which I guess are not a criteria, but I just wanted to have that on the record. I still think that intersection needs some review when you guys feel it's the appropriate time again.
I will comment down the tree. I've been out there myself in multiple vehicles and on foot. If you follow proper rules of the road where you stop at the stop bar and then see that you can't see and inch forward, which is allowed by the rules of the road, you can see around the tree. And actually what plays more into effect on that one is the curve in the road. So the curve is actually more impactful than the tree, but neither of which are significant to warrant a stop sign.
What about the unsignalized area? Or I guess, could you explain that criteria a little more? The unsignalized intersection in a signalized area.
So that refers to traffic signals. There are many criteria that go into putting in a stop sign. They're called traffic warrants. There's 8 of them. Some of them don't apply because there's not a railroad in the area. So when we did the last study on that, we did traffic counts. We did everything to go through the actual warrants to see if a 4-way stop sign was warranted, and it was not. And since even with a little bit more traffic from the new houses built down there, it hasn't caused a significant change in the intersection, which we would review it once again. This has gone through previous Assistant City Engineer Craig Schronkweiler. I believe Joe Smith looked into it at one point. I've looked into it. Unfortunately, there's just nothing there that warrants a 4-way stop sign.
All right, other discussion items. James?
I realize this isn't relevant to the actual thing that we're talking about. I want to add my voice to Grace's. I think the expansion of the subdivision to the south and the fact that we didn't put a road through all the way to Philo Road is going to increase the demand in this area. So I think that wait another 5 years option should be shortened. Thanks.
All right, any other discussion on this particular item? All right, with that, will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Hersey, Ms. Hersey,
Yes.
Ms. Colasetti,
Yes.
Ms. Bishop,
Yes.
Ms. Wilkin,
Yes.
Mr. Quisenberry. I didn't hear him.
You're muted.
Yes.
Okay, thank you.
All right, that passes. Next item on the agenda is resolution number 2021-12051R, resolution for improvement under the Illinois Highway Code, the state motor fuel tax for Goodwin Avenue and Green Street intersection improvement. That is Public Works, and I saw Tim. Tim, are you presenting on this one?
I am, thank you. So this is a past project. This was completed, it started, I believe, in 2012 when the original resolution was passed. And then design and construction commenced in 2013 and construction was completed in 2014. This was funded partially through a federal grant program, which picked up the bill on 80% of the cost of this. The way those grant agreements work is you come up with a project budget they sign off on it and say, okay, we're giving you 80% of this project budget. If this project exceeds that, it'll be your responsibility as the local agency. What ended up happening, if you look at page 2 on that memo, it kind of highlights it a little bit, is the construction cost, the construction bids came in higher than what we had anticipated, approximately $40,000 at the end of the day. And in doing so, we had never passed the supplemental resolution to appropriate additional funds for that. At the time, we could have paid that out of either another fund, or if we're going to use state motor fuel tax funds, they require a supplemental resolution for that. And that's what this is. This is basically the supplemental resolution to make up the difference we had 180,000 passed originally, and 176,853 was kind of the estimate at the time, and we ended up spending 216. So that additional 36,000 that we have this resolution made out for and change will cover the additional costs that were associated with construction for this project. And this was one of the, we had a number of open sections open that sometimes the timeline with these projects just takes a while. Depending on how it's going. So closeout never occurred, even though it probably should have sometime after shortly thereafter 2014. So now we're kind of whittling down at those. We had over 30 open at one point. I think we're down at less than 10 at this point. And that is kind of doing the final audit of the project. We set a resolution to appropriate funds, and then whatever the final expenditures are, we're coming back and doing a final expenditures report to IDOT, which is what we were attempting to do with this when they found that we had never found a supplemental resolution to appropriate those funds.
All right, questions for Tim? James?
Yeah, this is probably a little more procedural, but I noticed that this was named for Goodwin and Green intersection, but it looks like there's a Gregory and Green intersection component too.
That's a typo. It's I'll make sure I get that corrected. It's Goodwin and Green intersection, and the cross streets are Gregory to Matthews or Illinois to Springfield on Goodwin. It didn't necessarily extend to Gregory or Matthews or Illinois to Springfield, but it extended beyond the intersection itself. So those are just the cross streets for reference.
All right, thanks.
Yep.
All right, Grace?
Thank you. I'm just trying to make sure that I'm understanding this correctly. If you could let me know if this is correct. So this IDOT projects that needed to be complete from almost 10 years ago. So you gave us this original resolution from 2012. Is that right?
Mm-hmm. Yep.
And so we've been needing to get these because they were identified by IDOT as needing repair. Is that right?
So we essentially requested grant funds to help participate in this, and that's what that 80% of the federal grant was. They said, yeah, we agree this meets the terms of the grant program at the time, and in doing so, it's an 80-20 match in that grant program. So our 20% was that 180,000 originally, and because the construction costs were more than what were anticipated originally, we had to foot the bill for that additional funds.
And that's the additional 36,000.
Correct.
We're increasing to meet what we need to meet in addition to the grant to get this project completed.
Correct. Correct. Yeah, and if you look at that second page, it was the construction bids. The engineering costs were all in line with what we had originally estimated, but the bids just came in higher than estimated.
Okay. And do any of these streets involve unique stuff? Like, are they the brick or anything? Or are they traditional kind of paving?
I think this is traditional pavement in this area, the area of the intersection.
Okay, thank you.
Mm-hmm.
All right, other questions for staff? If not, I would entertain a motion.
I'll move resolution number 2021-12-051R, resolution for improvement under Illinois Highway Code State Motor Fuel Tax for Goodwin Avenue and Green Street intersection improvements with recommendation for approval on, can we consent agenda it?
Yep.
Put it there then.
All right, moved by Grace and seconded by Jaya. Discussion. All right, seeing none, will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Quisenberry, Mr. Quisenberry.
Yes, for some reason my space bar isn't unmuting.
Okay.
Sorry.
Ms. Wilkin,
Yes.
Ms. Bishop,
Yes.
Ms. Hersey,
Yes.
Ms. Colacetti,
Yes.
Mr. Evans.
Yes.
All right, that motion goes to City Council consent agenda. The last item on our agenda tonight is council input and communication. Is there anybody who would like to provide input tonight? Jaya?
I just want to take a moment to thank our public health officials, our medical care system. I've been out of CU, outside of Urbana recently, and I don't know if we say it enough of just how much the folks who are at the front lines of the pandemic have done to make sure that we have access to vaccines, to the boosters, to rapid testing. And so to echo the points that the mayor brought up earlier, just really hope that people take advantage of the incredible resources we have. The winter, we always see spikes, whether it's the flu, we saw this with COVID last year. So, honoring and appreciating the work that our medical professionals and our public health officials have been doing, and recognizing that we all still can make a difference with masking and taking advantage of the resources that are in our community. So just a thank you and echoing, please take advantage of the resources we have.
All right, thank you. Don't know how I get to see other people. People have disappeared from the screen, so I can't tell. Thank you. I can't tell if people want, James, did you have your hand up?
Yes, I do want to echo what Jazz said, and I do want to encourage the public to mask and to observe social distancing. I've not been out of the area, but I've been in the area, and I've been at some events and some locations where I found our discipline with regard to masking, particularly when we're in close quarters, has gotten really low. It's important, particularly with Omicron, which does seem to be more contagious and be able to break through, that we not ignore the fact that even if we're vaccinated and if you're in close quarters and you're not masked, you're at risk. Hopefully not too much at risk, because it also seems to be more manageable, particularly for those of us who have 3 shots or 2 shots. But we have to get back and resume the discipline, or we're going to have the same kind of issues where we need to shut things down or not be able to go watch basketball games or all kinds of things that we thought we were getting back to. People have to follow these recommendations and these requirements, or else it's just going to burst back up. So please think of each other as you do that. Get yourself vaccinated, wear your mask, and observe good social distancing.
All right, thank you. Let's see here, Grace, did you have something?
Yes, thanks. Wanted to say also thank yous to staff and the public for the presentations and input tonight and on a regular basis, and fellow council members and everyone who is willing to listen and share for the goal of the well-being of Urbana. And I hope that we can continue to work towards community well-being and that kind of hopeful tone. I think a lot of us have been hearing about Champaign's comprehensive blueprint plan for safety and looking forward to our community safety review. And just want to say that I look forward to that, and a total of hope and safety and trauma-informed healing and community support, and hope that we can continue that and work on a great comprehensive plan in Urbana, however that might be. And then overall, just wishing everyone a safe winter break and happy holidays. Hope that everyone has safe travels if they're traveling, and lots of COVID precautions, and a nice time to stay warm and reflect on this kind of things. And I think that's all. Thanks.
All right. Anybody else tonight? I don't see anybody. The paging through the different screens here. Well, with that, I want to wish everybody a happy, healthy, safe holiday break. We will see you here next year on January 3rd. With that, our meeting is adjourned. Thank you very much.